Hello everyone, myself Dr. Mounica Reddy. I'm a pediatric endocrinologist at Ankura Women and Child Health Hospitals in Hyderabad. So many times I face questions from parents. What is pediatric endocrinology or what does a pediatric endocrinologist do? So pediatric endocrinology is related diagnosing and treating the conditions of hormones in children. So these hormones are some chemical substances which are very important for growth, development and regular body functions in children as well as adults. And these hormones are released by glands which are called as endocrine glands. So a pediatric endocrinologist deals with all problems which are related to disorders or disturbances in these hormones or endocrine glands. Now, very frequently I face questions from parents. What are the conditions or what are the issues that we must be concerned with, or with what issues can we meet a pediatric endocrinologist? So let me just tell you a few conditions where you may seek support from a pediatric endocrinologist. So the foremost important condition in children is related to growth. For example, any height issues when parents are concerned that the child is short compared to his peer group, or maybe he is not growing as expected. Definitely you have to seek help. Similarly, weight related issues when the child is not gaining weight well or the child is gaining excess of weight, obesity or overweight, we do offer support. The other section is related to puberty. So puberty, if the child has delayed puberty or the child has early puberty, both in boys and girls, you need to meet a pediatric endocrinologist. And similarly, there might be various puberty related issues in adolescents, like for example irregular periods or issues related to polycystic ovarian syndrome, PCOS problems. So this all problems are dealt by a pediatric endocrinologist. Similarly, in newborn babies, there may be some problems which start from the birth, for example thyroid related problems or adrenal gland related problems, or there can be issues with maintaining the calcium levels in a newborn baby. So a pediatric endocrinologist offers support in these conditions. Also, the other important section what we deal with is pediatric diabetes. So there are two types of diabetes, type 1 and type 2 diabetes. Type 1 diabetes is common in children, and we do have all the testing facilities as well as for the treatment, all the advanced treatment systems available with us. The other problems what we deal with is related to bones. So if there are frequent fractures or if there is any deformity in the hands or legs or bone, or we call it rickets or vitamin D problems, so we do offer help. And similarly, if there are any issues with we call them disorders of sexual differentiation, like if there are any problem with the genitals in the child or a baby, we do offer a complete diagnosis and support. So these are just some of the few conditions what I have mentioned right now. But if as parents, if you face any issues with the hormone related or these glands or the growth related problems and what all I have mentioned, you can definitely visit us, and we ensure you that we have all the lab testing facilities as well as the right amount of technology, advanced treatment available, and the right support system. Being a pediatric hospital, we give a comprehensive and a holistic child care here. Thank you.